And there is nothing more powerful on this earth than that maternal intuition that is so heightened right before delivery and in that first 3 months, which is kind of known, and like I said, in the Eastern wisdom as the fourth trimester.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Today, I would love to introduce a wonderful guest who I've come to know over the last year. Dr. Romie is a traditionally trained neurologist with additional board certification in integrative medicine. Dr. Romie helps individuals and audiences learning to heal from stress-based illnesses such as insomnia, anxiety, and career burnout. Her innovative program, Mindset Matters, is based in neuroscience, positive psychology, and mindfulness. Dr. Romie completed her medical training at the Medical University of South Carolina, University of Pittsburgh Medical Center, and the University of Michigan, where she won numerous teaching and research awards. She previously served as a faculty at the Medical College of Wisconsin. After surviving career burnout and undergoing life-saving surgery, she traveled the world learning various yoga and mindfulness techniques. Dr. Romie is a media expert, analyst, and regular contributor in national and local media outlets. She shared her journey in a TED Talk, Is the Powerful Secret of Your Breath. When not speaking around the country, she heals clients at the Center for Natural and Integrative Medicine in Orlando, Florida. On a personal note, I became knowledgeable about Dr. Romie from a wonderful podcast that I listened to, and that was from the Biz Chicks and with Natalie Ekdahl. And she turned me on to, she did one of those shares for your periscopes, and this is probably about a year ago. And on that one, you were talking about a lot of sleep issues. It seems that as Americans, we have a lot of sleep issues. And you were talking about melatonin at that time. And you were very gracious and answered a question that I had about melatonin because my husband was having some issues. And it has helped him tremendously. And I've just been a fan of yours ever since. I've watched many other periscopes. I've seen you on Blabs with Natalie. I've heard your podcast. The other day, I was just sitting around and you came on with, I think is it Fox News in Orlando? You were talking about the Zika virus. So you are just a wealth of knowledge in many areas. And today we're going to talk about sleeping and the pregnant and postpartum mom. Welcome to All About Breastfeeding, Dr. Romie. I'm so happy you're able to be with us today.
Oh, Lori, thank you. Thank you for that just beautiful introduction. And yes, it's amazing how we can have the ability to connect with people via social media these days. I actually remember you chatting with me on Periscope. And while I'm not on Periscope as regularly anymore, I think Facebook Live has overtaken it. It's become one of my favorite ways to really get to know members of my community is via video. Isn't it so exciting? So thank you for inviting me to your great podcast.
You're welcome. There's so much that we could talk over. And like we said, I could ask you one question and we can talk for an hour. So I really want to zero in on how helpful you can be to pregnant moms and new mothers. And they have, another whole set of sleeping issues in pregnancy. We're talking about getting moms on a routine, but the little baby in the belly sometimes does not allow them to keep on a routine. It's floating around in there and moving around and causing indigestion, causing little knocks against their ribs, and it interrupts what might be a routine that they're trying to get on. The bladder is squished, so they got to get up frequently to pee. My audience has probably not heard of you, and I really want them to get to know just a little bit about your background. And I think if you can go over what is so interesting, because you're a neurologist, but now your life has taken on a different turn. And I really want my audience to know why you're so passionate about the turn it's taken. And I think, if I'm correct, a lot has to do with the major medical issue that you had. So can you tell us a little bit about that before we move on to how you can help my listeners?
Absolutely, Lori. Yeah, thank you for this opportunity. I looking back now, I realize if any of your listeners are in this moment right now where you feel like life has pulled out the rug from underneath you, know that Lori and I are sitting here first and foremost holding intention for you. But it's those moments that really, once we are down on our knees and humbled, learn the greatest. And for me, that was switching from a role from a doctor to a patient. And ironically, you and I are talking about sleep deprivation today. My early career as a neurologist specializing in epilepsy was working 90, 100 plus hours a week between seeing patients and doing research and traveling the country talking about my research and teaching medical students. And I was sleep deprived. Our neurology patients are prone to emergencies. You get the phone call, you get up in the middle of the night, you go, you help people the best of your abilities. And first of all, I think I didn't like person I was becoming emotionally and kind of losing connection to my spirit. And it turns out I have a rare disease called achalasia, and the chronic sleep deprivation and the high stress lifestyle was making it worse, to the point, it took a while. We initially thought it was heartburn, and I slowly lost the ability to swallow. I was choking and aspirating on anything I was eating. So to have acid go into your lungs or choke on food you're eating and get frequent pneumonia, it was horrible, and ended up needing life-saving surgery exactly 6 years ago from the time you and I are recording this podcast. And in that moment, I think going into the OR, this moment of self-reflection. And we are so defined sometimes in this country about the titles we have. I'm a doctor, I'm a daughter, I'm an important researcher. But it really forced me to ask this question that I think every new mother listening to this podcast is probably also asking. It's, who am I? At the core of your being, when you strip away all of the titles, all of your possessions, who are you? And that journey took me around the world, healing my mind and my body and my spirit, learning a lot of Eastern modalities of healing, Lori. So like Ayurveda and various types of mindfulness and meditation, yoga techniques. And I really was interested, like, how do I bring the Eastern medicine back to America, combine it with the amazing neurology, neuropsychology, neuroscience knowledge I have from being a doctor, and put that all together and help people with their brain and their mental health. And so that's like that humble journey I went through. And I went from being also a traditionally kind of paid doctor to an entrepreneur. I have been on this, journey ever since. And really, for the first time in my life, I can honestly say I can answer that question of who am I? And I can take that core essence of who I am and be of service to other people, whether it's helping patients one-on-one around the world with things like depression and anxiety and insomnia, or the great fun I have being in the media, talking about brain and mental health, as well as speaking to audiences all over the country. So I feel really blessed. And I share that with your audience members because know that I have been in that dark place. And I hear this from new mothers all the time, the sleep deprivation, the shock and the change of roles you're playing in your life. You can slip into this dark place, and there's light on the other side. And that's what I think you and I are here really to talk about today, Lori.
One other question around that, because we feel so alone and so isolated when we are in that deep, dark place. And can you tell me just a little more detail about that place that you were in, like in how long it lasted, and who in your life helped to support you in the changes that were going on? Or were you feeling like you were all alone in that journey also?
I think there are these moments in all of our life where we can feel alone, even when you're surrounded by a loved one, like a spouse or a supportive boyfriend, or I have very supportive and loving parents and all of that. And it just, when we are suffering and not feeling good in our mental and physical health, it is a lonely feeling, because there is this place you slip into of nobody understands what I'm going through. And how did I think, come out of it was through my mindfulness practice, really, and prayer, and realizing that we really are one with the universe. Whatever I think religion people have or their path to spirituality, once I really understood and in my meditation practice took me to that place that you're with one consciousness, I realized that we're truly never alone in this world. And in that moment, I started to see the blessings all around me. My family and my friends, I had a very, very large group of people of every religion, every form of spirituality praying for me when I underwent surgery. And it was that moment that uplifted me. And I think that's really at the core of what I do now. Is I call myself people's chief hope holder, is that I'm really holding the intention of hope and healing for others. When you've been in that awesome place, and even strangers or people you don't know, I was getting letters from people in temples and churches and synagogues saying, somebody asked me to pray for you. And I was just moved to hear the story. And I would get that. And you just realize, like, we are never really alone. And in those moments that we feel alone, it's only because we're focused on the darkness and not on the light.
Yeah, thanks for sharing that we are never really alone. We feel like it, but we're never really alone. Thanks so much for that. What can you tell me about what you've learned that pregnant moms have taught you about how to help them?
So one very special thing, I got to work with a lot of pregnant women in a very critical place in their life. One of the big research projects I had was I was the head and founded the Women with Epilepsy Comprehensive Center at the Medical College of Wisconsin. And that meant that I was seeing women in all of their phases of life and doing a lot of research. And this included taking care of dozens at a time of patients all over the Midwest who were pregnant and also had epilepsy. And so it became this intimate journey. And it was why I never slept, because even if a colleague was on call, if it was a pregnant patient, the doctor or the patient themselves were reaching out to me directly. And I got to learn a lot through that process. And this is it, Lori, is pregnancy is a time that is sacred. But because of the Western lifestyle that we lead, and, sometimes we can't help it, where you're maybe juggling taking care of other kids and your marriage and working full time, it's easy to become disconnected from your pregnancy. And you only think about it when there is a reminder, a loving reminder, your baby may kick, a painful reminder, the lower back pain or the difficulty sleeping we were alluding to. And when you're disconnected from such a holy or spiritual process that's happening in your body, I think that's where the discomfort comes from. And the same is true once you give birth and you're in the process of breastfeeding or bottle feeding at night. Eastern wisdom, it's known as like your fourth trimester, that first 3 to 4 months after your baby is born. And there's so many people that are pressured to leave that holy cocoon and go back into normal life. I think that's where a lot of the strife happens physically, mentally, spiritually with new moms.
I'm so glad that you're connected with moms, you've worked with moms, because you really understand that it's just not so easy to turn things off. Mothers, they're working, they have marriages, they have relationships, their daughters, their sisters, their friends, they have children. So can you zero in on a tip or two that we can share with pregnant moms? Is there something that they could do in the middle of the day? Is there something that they could do when they're winding down for the end of the day to help them get a little bit more restful sleep for the few hours in a row that they are able to sleep?
So, Lori, first of all, my advice starts in a general place, is that there's never this one size fits all. And when pregnancy or being a newborn mom becomes stressful, is because you're trying to follow a routine that is not in your nature. And let me explain that a little bit. What is so stressful for moms is there's so much parenting advice out there. And the minute you settle in one, you can sometimes feel like, oh, I'm not being the best mom. I need to try something different. And the truth of the matter is, every baby that is born is different, and every mother-child bond is different. And you really need to find that time to go within and understand your special bond with that child. And it could be different from other children you've given birth to. Create a routine that is natural to the both of you, and here's a simple example. I hear from moms often that, oh, my first child had to get up and be fed every 2 to 3 hours. And my second baby, quickly slept through the night. And it's not that one child is better or rewired differently. It's just the needs of every human spirit are different. And so the minute you really can tap into that sacred mother-child bond, you already intuitively know what you need and your child needs. So ignore all those parenting blogs that are telling you to do something different and listen to your maternal intuition. There is nothing more powerful on this earth than that maternal intuition that is so heightened right before delivery and in that first 3 months, which is kind of known, and like I said, in the Eastern wisdom as the fourth trimester. There's nothing more sacred than that time. And the maternal intuition is so heightened during that time.
And what's so interesting is that I know that and I do believe that. And yet there is so much advice out there from many different media outlets, as well as family, friends, physicians, books. And what I find is that mothers, particularly when it's their first time around, they have such a lack of confidence in their abilities as a mother that they are such an absorbent sponge to what everybody else is telling them. And they don't have the confidence to listen to that inner voice and pay attention to their intuition. So when I'm working with moms, I don't mean to be condescending to them or anything, but when they're asking me some questions in a nice way, I will say, well, what do you think you should do? What do you think your baby is telling you? And Dr. Romie, I'm telling you that 9 times out of 10, they already have the answer. They're just not sure or confident in it. And I do talk to women a lot about that. What's that little voice inside you saying? What's your intuition? Forget about what Dr. Smith told you about your baby and their sleeping habits and how you need to fit your baby into you. What is your baby telling you? And what can you do to work with this beautiful love relationship with just you and your baby? And to me, that's what a lot of that fourth trimester is about, especially the first 6 weeks, is ignoring by and large what other people are telling you and do what I call this whole baby moon thing and just spend time getting to know your baby. Now, we need to know safety. We need to know babies are getting fed well. And I work with moms with breastfeeding. In a bigger and smaller picture, I really talk to them a lot about tapping into that inner intuition that they already have. I want them to know they already have it. They just need to be quiet and still and be hanging out with their baby and be able to trust their instincts.
It is. Oh gosh, Laura, what a gift you are to the mothers, and you're absolutely right. And I will probably add to it that it's not 9 out of 10 mothers know what to do. Every single mother knows what to do. And that 1 out of 10 mother that is still not sure when you ask them, what's your intuition telling you? They're just understandably maybe full of fear or confusion because of all the conflicting advice they got. And we just need to help them turn off all of that external noise, because really at the core of what I do in my medical intuitive work, with all patients, not just, pregnant women or new moms, is helping people tap in. The body always knows intuitively what it needs to heal, from a spiritual standpoint of view. And of course, we need to add medications, or somebody may need surgery or whatever. But when you know that's what your body needs, you're very open to those things. And so you're right. To go back to the new moms, we really need to help them shut out the noise. And I don't know what you see, Lori, but I see this often with friends and patients who are new moms. I call it mom shaming. And I don't know if you have a term with it, but it's like in no other situation do people just walk up to a stranger and start telling them what to do. But you see a pregnant woman or a mother with a newborn, and all of a sudden people feel the need to walk up and say, oh, well, this is how I fed my child, or this is how I cradled them. And it's like, well, thank you for sharing, but I didn't really ask for your advice. And it's this form of mom shaming. And especially if it's a new mom or a mom that may be struggling with, a second or third child, you're already not feeling confident. And if somebody comes and just starts telling you what to do, it's a little jarring. It's like someone's questioning your motherhood. And we need to stop that mom shaming.
I know. I call it's like a free-for-all. You see a pregnant belly, and for the next 9 months and the next couple of years, it's just like a free-for-all for anybody to feel like they can tell you what they think about how you're carrying your baby, what sex you might have, when they think you're due, all kinds of things about pregnancy and how you're taking care of yourself. Then you have the baby. The free-for-all just continues about how you hold your baby, swaddle your baby, positions you breastfeed your baby, and what you're dressing them in. You're right. It's like a total free-for-all. And
so probably the one thing we could do is bring in these psychology things of really, I use this kind of two-step, is when somebody is saying something to you, if it feels yucky, just tap into that and know that that's your spirit saying, this person may mean well, but that is not what I need and my baby needs. And number two, it's setting a loving, nurturing boundary. Like, thank you for sharing your pregnancy or breastfeeding experience, but I'm really at peace on my own path with my baby. I'm really happy with the routine I have for my child. And it's in a very loving way, setting a boundary. It's kind of like, back off.
And it's the most interesting thing in that. Again, I think it's that vulnerability and lack of confidence that we feel. But I cannot tell you how many women have a hard time saying that to someone in a nice way. Yeah. Back off. I'm happy with how things are going. I'm figuring it out on my own. Yeah. Thank you, but no thank you. So many people they live with, and happens a lot postpartum because mothers, mother-in-laws, aunts are coming and staying with them. Mm-hmm. They all have different advice.
So it's like, thank you for sharing, Mom. Thank you for sharing. And in-law relationships are even trickier. So I respect that, or thank you for sharing, Auntie. And I know you're sharing from a place of love, but I'm really at peace. Because Lori, if you had to ask me again, another valuable lesson that I would pass on from my life to new moms, and I would say this, I never would have done the cutting edge research I did as a neurologist and epileptologist helping women at all phases of life had I listened to other men's well-meaning advice, right? And I wouldn't be a successful entrepreneur doing this visionary work of bringing Eastern and Western medicine had I not set these boundaries. And any time that I've had a setback, it's because I allowed someone else's yucky energy, yucky advice, their fears, I allowed it to come in. And so if there is one thing people can do to succeed in their professional life or themselves as a mother, it's really learn early and quickly how to set these emotional boundaries and in a loving way. And, and understanding that when you tell somebody no, or you set that boundary, it's not that you're offending them. It's not that you're hurting someone's feeling. If you do it in a nurturing way, you're actually kind of teaching people how to respect and love you.
What I would tell my audience is to listen to this. Take the words that Dr. Romie is saying, make it your own, Put it on an index card, put a sentence or two on an index card, and literally memorize those words so that when a situation arises, you can pull it out right away. And that it sounds not by that you have memorized something, that you become so comfortable saying those words when you're in an awkward position or when you're feeling someone is a little bit too much in your face, you can just come out with that line or two. And I think that's extremely valuable information, because part of that stuff is what brings us down and is entering our brain in when we try and wind down at the end of the day. We may be thinking about all the stuff that we were told that doesn't sit right, that helps bring out additional fears of our own. And we have our mind working overtime when we do try and sit and lay down to sleep. Taking a little break so I can share this info with you. I am really psyched to be able to share this next piece of news with you. My regular listeners are very familiar at this point with Momentum, the organization that I talk about on each show. You know the one that I say saved my life as a new mother, the organization that helped me find other mothers who were new at this whole mothering thing. They became my people. They helped me navigate that first year of motherhood and continue to mother me as I had more kids and my need for support through their toddler years and kindergarten years and elementary school years just kept being needed. I made lifelong friends, and they were so helpful that I am doing all I can to continue to support the organization. I want Momentum to continue to thrive, and I want you, my All About Breastfeeding audience, to experience just some of what Momentum is all about. The ladies of Momentum have agreed to give my listeners a 14-day trial membership so you can see what this Mother Center thing is all about at no cost to you. Just hop on over to allaboutbreastfeeding.biz/podcast. You will see a link from Momentum. It's in blue, and you just click it on and it will bring you to the page for you to sign up for your free trial. Honestly and truly, there's absolutely no cost to you. This is just a great opportunity for you to enjoy the discussion groups and the blogs and webinars and educational pieces that are available for free for you. I will have a link to this in the show notes. And now, back to the show. So I want to know, is there even just a short meditation or something that a mom can do? Let's go back to the pregnant mom, because I really want to give her at least one tip, what she can do to help her fall asleep at night if she is having a problem.
Oh, that's a great question, Lori. So with the pregnant mom, I'm going to start and say this is, I would actually say both first thing when you wake up in the morning and when you are doing your nighttime routine to go to bed is please disconnect from the digital devices. I know, you're answering emails, you're looking on Facebook, you're pinning cute recipes or whatever to Pinterest. Put it down and create a sacred space in your home. It could be sitting on your bed. It could be sitting in your baby's room, wherever that is. And, just put both hands on your belly and close your eyes and talk to your child. There's nothing wrong or right to say, just speak your heart. Even if you're saying, good night, let's sleep well. Have that bonding time, because, the baby is this, the presence of angels and an extension of your own spirit. And we're doing so much naturally in the day to disconnect us from our spirits, and our baby when we're pregnant is that just find that quiet sacred time. And all it needs to be is 3 to 5 minutes. I know some of the pregnant women listening may be like, are you kidding? I'm chasing after another toddler. Find 3 to 5 minutes in the morning and before bedtime. And literally when we connect to spirit, it is the first way we start to calm our nervous system down and really welcome a relaxed state. And that can lead to a more peaceful sleep.
That's such wonderful advice for all of us to disconnect.
Yes.
Pregnant moms to disconnect and really put their hands on their belly, which a lot of us do during the daytime anyway. But what you're telling us is to really connect and talk to our baby. Yeah. And what I love about what you're saying is that some people do freak out about the time frame, but really, if you sit silently for 3, 4, 5 minutes, that's huge. And you're just paying attention to you, your baby, your belly. You're not plugged into anything, and your focus. That 3 to 5 minutes can go a long way in helping to settle your body and mind. Thanks so much for that.
No, you're welcome. You're welcome, Lori. And something to add on what you're saying, you're absolutely right, is if you're thinking, oh my gosh, how do I sit for 3 to 5 minutes? Sit there and talk to your baby about what we hold intention we're going to do for the day today. And at the end of the night, thank your baby and say, what a beautiful day we had together, and summarize what you're thankful for. And here is something I want to add. You're like, oh, that's really nice and spiritual, woo, Dr. Romie. But what the medical evidence behind that is, as a mom, when you're doing this to relax, you're lowering your blood pressure, you're lowering your heart rate. It's now opening up and relaxing your blood vessels so your muscles are relaxed, but it's also improving the blood flow to your womb, to the placenta and the nourishment, and helping a relaxation state in the womb for the baby as well. So it's just think of it as a relaxing exercise that's relaxing the mind and the body and the spirit of both you and your child.
When I taught childbirth classes, a lot of times I talked about what I call the wonderful placenta. And it's just this direct line to your baby. It's not just the nourishment, but it's everything else that's going on.
Yes.
So I love that you're saying that for moms to connect. One of the other things I wanted you to talk about, and I found this a lot in my own self with my pregnancies, is that I may have fallen asleep the first go around at night, but when my baby woke up every few hours, I was sitting up, or even if I was laying down feeding my baby, now my mind started working and being active again. Maybe I needed to turn on a light, but you just start everything all going again. And if we're lucky, after a feeding, our baby falls asleep. But we are now wired because it's 12 o'clock and then it's 3:30 and then it's 5 o'clock and then it's 6 o'clock. And I found those were the worst times for me to settle back down my mind. In addition to, more than likely because I was breastfeeding, I also got hungry in the middle of the night. And so if I wound up going to the kitchen and having something to eat, I was really waking myself up a whole bunch.
Mm-hmm.
What kind of practical tips do you have for those who run into the same problem and how to wind themselves down?
Again, there's no one right answer for every mom, Lori. And this is the practice of you getting to know your body. I think the one truth that would be universal to everybody is try to avoid the busy brain and the busy body in the middle of the night. And what I mean by that is a lot of new moms saying, well, it's 3 o'clock and I'm awake. I'll put in a load of laundry.
Right.
I'll get up and, sure, you want to eat, have maybe a snack that's easy to prepare, because now all of a sudden, if you get up and you start cooking eggs for yourself, then you see the dishes piled up, or you may see dishes from the night before. And so avoid those busy activities and really do the bare minimum, because the key is to keep the sight, the sound, what you're touching, what you're smelling, what you're tasting in a relaxed state of mind. And, we all relax in different ways. And so again, I think, so avoiding the busy brain and the busy body as best as possible. And the second thing is, please don't pick up the digital devices, because the minute you do that, and you start saying, okay, I'm breastfeeding, let me pick up the phone and look on Facebook or listen to some music, or I'll listen to a podcast. Please don't do that in the middle of the night. You're now waking your brain up, and the light from the devices are tricking your brain to thinking it's morning and you need to wake up.
Yes, you are absolutely right. When I was having my babies, I didn't have all the digital devices, but I did have the busy body and busy mind. Mm-hmm. And I used to intuitively, I knew that, but it was like another one of those discipline thing. I had to discipline myself to not get involved with anything else that I was doing. When I was able to discipline myself, then the night went a lot better. Mm-hmm. When I fell off the track, so to speak, and I decided to go into the kitchen, or I felt a little wired, so I sat myself in front of the TV, I might as well just be up for the next whole feeding time worth while my baby slept. Yeah. So to kind of cut that out. And with moms, when I talk to moms nowadays and they talk about having a problem getting sleep, I do talk to them. That is probably the number one issue that moms have nowadays, is getting connected. They go on Facebook, they're chatting with other moms. You're up at 2 a.m. I'm up at 2 a.m. too. Yeah. And then they get into a whole conversation about how they're up.
Here's the thing, because it's lonely waking up in the middle of the night.
Yes.
And what happens is, instead, and we're so wired in the society not to be quiet and be with ourselves, follow your baby's cycle. Your child, most of the time, it needs a diaper change, a feeding, and goes back to bed. That's your cue to feed them, maybe use the restroom if you need to, and go back to bed. And so as you feel your baby relaxing in your arms, just practice that relaxation too. And, if there's any time to talk silently to your child, to talk out loud to them, I've had clients that'll say, okay, I'll recite a prayer, I'll recite a mantra over and over with them. It's keeping your body and brain relaxed, just like you want to do for your baby. It's a discipline. It's literally like training for a marathon, because our bodies and brains are scheduled to get up and do something. But no, just be one with your baby. Be one with your baby and follow their lead.
You're so right. It's such of that KISS mode. Just keep everything simple. And sometimes we do try to complicate things too much. So that's great advice also. It's a lot of golden nuggets that you're sharing with us of some things that we might actually even know, but hearing it from someone, hearing it a different way, maybe a mom is in a different emotional headspace when they're hearing it. And I think part of it was what I say a lot in my own life, like maybe this time this will stick. Like what I already know, it will stick. Or I will remember that when it comes up from within, I'll remember that someone else said it, and I'll say, yes, this is just exactly what I need to do.
Yeah.
I'd like to know from your medical standpoint of view, if you can share with us how sleep deprivation creates a risk factor for moms in postpartum depression.
Oh, yes, Lori. I really, first of all, I honor our mothers, Lori, because they were in an age where hormonal imbalances in women were not recognized by the medical community. Postpartum depression wasn't. And we are so lucky that there are more infrastructure in place now and a little better screening, but not optimized. And so know this, that mood and memory changes are inevitable when we are sleep deprived. Now, on top of it, when you add in pregnancy and the cycle of breastfeeding, there's hormonal imbalances on top of it. And the more sleep deprived we are, the more hormonal imbalance we may experience. So it's like this self-fulfilling prophecy. What came first, the chicken or the egg, the hormonal imbalance or the sleep deprivation, and it feeding into the mood. And so if you're in that place right now, listening as a new mom or worried about it, again, please know that there's nothing wrong with your brain. This is a part of, something that can happen. We know that women who were prone to anxiety or depression even before pregnancy may have a higher risk, or something else really important that doesn't get screened for that can add to the risk factors of postpartum depression is an iron deficiency or hypothyroid or low thyroid levels. And those really need to get screened. And the last one is vitamin D as in dog 3 levels. The body is already kind of depleted through pregnancy, and if we're not eating whole nutrition foods, it just becomes augmented then. And so those are things that very quickly, post-delivery, you need to screen for. And taking vitamin D as in dog 3 supplements, fish oils to help hormones, vitamin B complex and iron, if you need it and your levels are low, is absolutely safe and for you and the baby. You need to do that. So one, there's the kind of basic things I think every doctor should be screening in a mother who's sleep deprived. But two, yes, until you get your sleep back again, the risk factors to have anxiety or depression or feeling like you're in that brain fog are there, and don't fight the feeling. If you're one with it, you understand like, okay, this is temporary. This is where I am right now because of the sleep deprivation. You're much more likely to push through it. And anytime we're in this place, we have to process the emotions and accept them and then push through it rather than trying to self-shame. Oh my gosh, I'm getting depressed after this pregnancy. It didn't happen with the previous pregnancy, or it didn't happen to any of my friends. Why is it me? When we kind of go into that fatalistic, I'm all alone thinking, that's where I think we get stuck in the darkness a little bit longer. I don't know if all of that helps, Lori.
Yeah, it helps a lot. I'm a huge fan of screening after the pregnancy. What I find is that a lot of moms come back to me and tell me that their doctors don't want to run any tests, do any screening for things like iron and thyroid, et cetera, until they're about 12 weeks postpartum, because the levels I know do change from pregnancy, giving birth. And I wouldn't pretend to be a physician on that, but I don't know. It feels like 12 weeks is way too long. Like we can do things sooner for moms.
Well, I think if moms are symptomatic, we need to check these things sooner, right? Because I'd rather we check and correct levels or understand what potentially may be going on rather than, just rushing to a medication that may or may not help. So once I think someone is symptomatic, we actually do go to levels quicker.
I'm a huge fan of keeping things simple and working our way up, but I am curious because melatonin has been so helpful to my husband and some friends that I've spoken to about it. What about melatonin in the pregnant and nursing mom?
There isn't data about really safely giving melatonin in the nursing mom. So it's an individual discussion you would need to have with your doctor. But remember, what melatonin is doing is helping to restore your circadian rhythm of sleep and wake. And we know the sleep-wake cycle is already being challenged because you're waking up multiple times during the night to feed. And sometimes, I hope, for the non-working moms that may be home breastfeeding their newborn baby is catching up with sleep during the day. So probably melatonin in that first few months, especially if you're breastfeeding, is not advisable, to be honest, Lori, for that reason. And melatonin isn't the end all be all sleep thing for everybody. There are specific certain, like when we're talking about the non-pregnant mom or the mom who's not breastfeeding, but just if any mothers are listening who have insomnia, there's just specific indications where we give melatonin. And that's, my goodness, a whole nother podcast. Or if somebody wants a personal consultation in insomnia, they can, reach out to us through our website. We do virtual consultations. But yeah, melatonin isn't something we prescribe for everybody, Lori, for insomnia. There's just certain patterns that fit for insomnia that we do that for.
Yeah, that was pretty much aligned to my thinking. I certainly don't counsel moms on that. But, to me, on a very basic level, I was thinking if they're constantly going to be getting up and then going back to sleep and then getting up and going back to sleep, there's the safety of the medication to the baby. But there's also how effective can it really be if that is our lifestyle for that particular time.
And really what we've done for moms that are really needing the rest is if there is a support system, all these well-meaning friends and aunts and sisters and mothers and mother-in-laws, who come to help, it's really asking these women in our lives who come to help to do other tasks at home. So you're not feeling like there's a to-do list to keep your brain and your body busy, and pumping milk is an option, and having someone help with one or two of the nighttime feedings, even once a week. If someone came to stay with you and you got a full night's sleep, it would do wonders to restore. So it's just, again, creating these personalized systems, Lori, which I know you help mothers do, and everybody's needs are individualized. But if they can get a support system in to help them with a 4 to 6 hour stretch of sleep, even once a week, it makes all the difference in the world.
Great advice. There's a question that I ask most of the mothers who are on my show, because most of them are breastfeeding moms or have breastfed. And I want to ask you just a little bit different of a twist. You became very, very ill. I would like to know if you could put your arms around yourself before you became ill, what would you have whispered in your ear? What words of wisdom would you have liked to have told yourself or known?
You will get through this time, and the quicker or whatever way you find to connect to your faith, the easier it will be, because hard times fall upon all of us, but the presence of grace and light are always with us. And it's in these dark moments we think we've been abandoned by God, by Spirit, the universe, and that's when we are closest, and all we need to do is ask. So I think that would have been one thing. The second thing I would have told myself, Lori, is, even looking back now, I know I was getting whispers and hints in my meditation and prayer practices before I became very sick, that I needed to slow down, that I wasn't kind of on my path of my purpose anymore. I wasn't listening to myself. So really knowing that everyone has a powerful intuition. Most of us just have self-doubt, or we don't understand how powerful our intuition is until something really devastating happens, right? Where I call it like God opens up the clouds and throws a brick upside your head because you didn't listen to the whispers. And so I think it would have been to please trust your intuition. Your intuition will never steer you wrong in your life. And so I think those are the two things: is always trust your intuition, and two, it's never lose sight of the fact that the light of grace and hope are always surrounding you, even in your most darkest times.
Wonderful. Thank you so much. I wanted to add to that. It seems that many of the conversations I have with my guests lend to talking about intuition and fears. And anytime that does come up, I always like to share this book. It's called The Gift of Fear, and it's by Gavin de Becker. And it really has a lot to do with women in safety, meaning women who are in the middle of the night, someone comes and steals or rapes, or they're getting on that elevator. The thing that Gavin talks about is that most women, if you ask them, they did say that they felt unsafe in that place, but they didn't do anything about it because they felt silly. They felt that that person wasn't good to be around, but they were kind of embarrassed to walk away. And so by and large, that book is talking about is about a lot of women and personal safety. Mm-hmm. But the bigger message is listening to your intuition. And I think it's a great book, a little bit different from the mind and the psychology and more about the emotions surrounding it.
Yeah.
But I just wanted to mention that. And I don't know if you've ever read that, but you might find it a good read.
I will. Thank you. Yeah, it is. If moms are listening right now going, okay, I get it. And Laura, you talk about intuition a lot. And Dr. Romie, here you are as a doctor. Like, how do I know it's my intuition or is my mind just playing tricks on me? Well, first and foremost, when you're pregnant and have just delivered, your intuitive senses are really heightened. And two, when it's your intuition, there is no doubt. And it's the fear or pre-programmed limiting beliefs that come up later. Like, Romie, if you leave your job, you're going to be destitute and poor and never eat again or something. That's a limiting belief, But your intuition will never steer you wrong. And with most people, there is actually a physical sensation somewhere in the body. And, I work with clients one-on-one to teach them this so that at any time, you know what your body and how your mind is reacting.
Yeah, we've had a lot of stuff that enters, like you talked about pre-programming from like childhood when we're so much better at all of this, but it's kind of been squashed by mainstream education, media, people that come into our lives, in various things. So I think intuition is really a wonderful thing for us to pay attention to, learn a little bit more and trust. One of the things I wanted to say is that for people who are listening, one of the things I really hope that you're getting from my discussion with Dr. Romie is there is not one way. We're talking about sleep and helping you sleep. I think there's no secret sauce. Everybody is an individual. Dr. Romie is exactly right. What I really want to come back to, which is if someone's thinking, well, what was that checklist of 5 things I should do? What I really want you to pay attention to is that whole keep it simple thing again. It's bringing us back to basically what we already know about ourselves, listening and being quiet and paying attention to it as we're one with our baby in the belly. So we're 2, but when our baby is on the outside, to do your best and trust that following your babies, their rhythm will help you a whole bunch, and trying to fight it and get involved in other things. And like you said, busy body, busy mind. I think if you really just keep it simple and listen to what Dr. Romie said, that you will get some of the results that you're looking for, which is more restful sleep, easier to wind down, that there is no magic pill, there is no secret sauce. It's really coming back to basics and paying attention to what's going on with you and your life, in your home, in your bed. Thank you so much for that, Dr. Romie. What I wanted to do is I first wanted to ask you if there's anything else that I haven't asked you that you wanted to contribute to this conversation before I ask you to tell us a little bit about the work that you're currently doing.
Oh, yeah. Thank you, Laura. No, thank you. It's been enlightening, and just know that I'm here holding intention for all the moms to be and the mothers who have delivered, that, you are able to connect to that light of grace and the power of your intuition to guide you through this really sacred time. And that I hope you find that time to sit and be one with your baby in your belly, and, be present during their feedings, and, allow that sacred bonding time to happen, even if it's just a few minutes at a time. And, right now I am really passionate about, spreading this message of how we can bring mindfulness and Eastern medicine into helping our brain and mental health. And if I can, help anybody, we give free advice every week. Go to drromie.com, sign up. You'll get a free guided meditation, free sleep guide. You can join us there, and always here to be of service. And if the last thing I'll say is if you're suffering from anxiety or depression or any mood changes that are just not you after your delivery, please go talk to a professional medical doctor, and, don't sit at home alone or be in shame with it. That's really, I think, my service announcement is know that you're not alone, and please talk to somebody about it.
And I'd also like to ask you, you are a wonderful speaker, and I know that you go around speaking at different conferences and organizations. My listeners, I'm going to put a link in there. You gave a fabulous TED Talk.
Thank you.
So I'm going to put a link in for that. I think everybody will really enjoy that. And I just like to know, you never know who is listening. If anybody is looking for a fabulous speaker, you've heard her here. You can see how I think you're just so connected. You can take your message and your passion and your wisdom, and you can really relate it to any group of people that you're talking to, whatever organization. So if anybody's looking for a great uplifting speaker that's knowledgeable, you can also connect with Dr. Romie too. So your website is Dr. Romie, so DrRomie.com, correct?
Yes. Thank you, Lori. And thank you for that. Yeah, it's an honor to be able to share a message with audiences on how to manage stress and really shift the brain to a happy place. So thank you for that. And absolutely, DrRomie.com if we can ever be of service. And we just I'll close out by just setting a healing intention for all the moms that are listening to this podcast or that'll listen to it in the future, is just know that you are absolutely whole and as a mother exactly the way you are. And I hope you sit in that profound knowledge of you have everything you need to be a wonderful mother to your child, and just trust in yourself.
I could not have ended this conversation any better. So I am going to leave it at that. And thank you so much. I really appreciate your time and your wisdom and your energy, Dr. Romie.
You're welcome, Lori.
Thanks for hanging out with me for another great show here at All About Breastfeeding. If you would like to learn more about me, please check out allaboutbreastfeeding.biz/about. Until the next show, bye-bye.